Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and on this show, I like to interview health stakeholders about their vision to improve healthcare. And I say that health stakeholders because it may or may not be someone who works in healthcare or with a quote unquote financial stake in healthcare, but it could be just any human person because we all have a stake in healthcare. And this one is Madison Levine. Thank you so much for being with me today.
Thank you for having me, Rosa. I'm so excited to be here.
Madison and I met on Instagram, which is the best use of social media.
It is.
So
Make new friends.
yes. Well, and I just love how you've been like really sharing what you're passionate about and the difference that you're working to make. And I can't remember if I initially saw your TEDx talk or I think we may have found each other in the comments of something else. Do you
Yeah,
even remember?
yeah, I think so. It was around that time frame last summer, and I was definitely looking for people who were in more of the neurology space, like
Yeah.
what you're doing, and I've been following you and what you do, and you are just such an incredible advocate. So
Sorry, which is why we were magnetically drawn to each other, right? So, tell us a little bit about your TEDx talk that really grabbed my attention so everybody else can hear what you're passionate about.
yeah, I was able to boil down an 8-minute talk on the ear brain connection. I am incredibly passionate about this topic because what I do for a living is I help people hear better. And I personally have had family members who have had cognition issues, Alzheimer's, and those had huge impacts on me. Now, working in a space where every day I'm meeting people who are having cognitive concerns, it's it's hard and I want to help them. And so we find that the earlier that people are treating hearing issues, the less cognitive breakdown we have down the road. So I'm pulling the research together and I'm sharing it with people like you in community talks. And I got to do that TEDx, which was a very cool experience.
Yes, and you were stellar. I must say, I suspect that you gave such a great TEDx talk because you're so good at enunciating and speaking very clearly and on purpose because you need your people to hear you.
Yes, this is a
Yeah.
hazard of this profession. I used to have a Southern accent. I don't think I do
No.
anymore. Yeah, I'm from middle Georgia, which is the middle of the South. And
What?
I've lost it because of how I speak at work so carefully.
Right. And so, how does that work? Because you said your mom was in the same line of work when you were growing up, right?
Yeah, she was. And she didn't have too deep of an accent either. But my
Okay.
dad and the rest of my family did. Yeah,
Okay. But then I guess also she was able to model for you what effective communication looked like in that case, right?
she was very practiced. She ran a clinic for 35 years and she had purchased it from a woman who had run it for 30 years before that,
Whoa.
which is isn't that incredible to imagine
People been doing
70
it that long?
years ago, what would a hearing appliance look like? How were we able to help people? And I mean, back
You're
then they were
holding.
wearing the boxes.
How did that work? I never even saw that.
Not that great, but it was an amplifier. It just,
Were they just wearing a speaker around them?
yeah, basically it made everything so loud.
That sounds awful
Well,
for everybody.
we're in a whole different world now. Now we have, imagine people mixing music and the nuance to that. You've got all these different frequencies, you've got compression, so you can make sound much more natural now than you could have back then.
Yeah, exactly. And then, so you and I really bonded over this because I have been working with people after stroke. Sometimes hearing is impacted, and then a lot of people who have strokes are older and
Mhm.
they've had some hearing loss anyway. And we were talking about how that can really impact their cognition and also their recovery, right? So their cognition may have already been affected prior to the stroke, but in order for them to really hear the instructions in order to get better, to recover, having that hearing evaluation can really come in handy, but it can be a sore subject for like children to bring up to their parents, for example.
Yes.
So, what is with that? Because, I mean, no, I don't know that there's any reason to be ashamed of not being able to hear, right? I mean,
I
so
agree.
what is the pride issue there, do you think?
Gosh, I agree so much. I've wondered this whole time. I've been in this profession for 14 years. And what I see, because I work with different demographics, I have people in their 20s with hearing loss, 40s, 50s, but the most common group I see are people in their 70s and 80s, right? There's a larger proportion of hearing loss there. It's interesting. The older someone is, the more perceived stigma it seems like they have. That they think someone else is going to think they're old because they're wearing a device. But my people who
Because
are
they
40,
see the device.
well, and they're so much more invisible now.
Yeah,
But my people in their 40s, 50s, 60s, they don't think anything of it because you and I know everybody's got something in their ear these days. We've all got a
true.
Bluetooth device, and you may not know, but hearing aids now are Bluetooth, and
Yeah,
they're counting your steps like a Fitbit, and they're translating languages, and they're
you're answering your phone.
answering your phone.
One of my
Can't
best
we?
friends has a hearing aid, and I can get her if I call her better than if I text her because the call will go to her hearing aid.
And it's right there, so it's so clear.
Mhm.
But what if we reverse the psychology? What if we thought of it first as a piece of tech,
Mhm.
Bluetooth, has all these features, and it changes the frequency response so that you hear clearly?
Yeah.
You know? So I'm with you. I think the stigma is going away, in my opinion.
Right. And so I think it's interesting to talk. I was thinking about this when I was getting ready to have this conversation with you tonight. And, for those of us who are younger, I think to an extent we need to have this conversation about the impact of hearing on cognition because I saw your post earlier about being an elder millennial
Yeah.
and how like we remember like recording things on cassette tapes so we can listen to songs from the radio later. But like when I was growing up, it was really big to not call people names to like emphasize that they were dumb, such
Mm-hmm.
as the R word that we won't
Mm-hmm.
use here, right?
Mm-hmm.
And I think maybe I'm suspecting this from what I've heard. Maybe in older generations, they perceived people who had a hearing disability as being dumb, for example. So, this is my hypothesis. Feel free to go do research on it and figure it out. But so maybe I'm hypothesizing they feel like if they are seen to have a hearing disability, people will assume they are dumb. Whereas people our age are not automatically going to assume somebody's dumb if they can't hear. However, what we're talking about is if you can't hear, you can't process what's going on around you. And if you don't use it, you lose it. And you
Mm-hmm.
could actually get dumber by not treating your hearing. Is that a terrible way to say it?
Gosh, no, but it's really straightforward. It's just kind of, I'm not afraid to hurt your feelings. If you don't use it, you will lose it. And, these are the kinds of conversations you may not have with a stranger, but you might have with your parent. You might say to your mom or
Right.
dad, listen, I'm over it. You have a problem and you need to fix it because I want you here not just for a long time, for a good time. I want you to be the
Yes!
girl, right?
That we're not just here for a long time. We're here for a good time. I love
Yeah.
that. That's what
Yeah,
it's
you're
all
so
about.
right. But I do think you're right about this idea of how we view disabilities now versus older generations. And it's because of so much advocacy work that's been done over the last few decades so that we don't use a lot of language that we grew up with. There's all kinds of words I heard regularly in high school that people casually called each other that we would never in a million years use today.
Yep.
And that's good. It's good. We've learned.
Yes, we don't need to go back to that. Well, and I think also, I don't know about you, but I was very exposed to like the works of Helen Keller, who was both deaf and blind and also brilliant. And so I think examples like that in that advocacy you're talking about of showing the brilliance of people who otherwise were considered to be disabled help to formulate this idea in our head of just because the way they communicate is different doesn't mean they're not smart or they can't understand things. You just have to find a way to communicate.
Absolutely. Absolutely. I'll tell you, whenever I think about Helen Keller, I think about this one quote from her. She said, obviously being blind and deaf, the question came up, how are they different? If you could have one back, what would you want back? And what she said was, blindness separates you from things, deafness separates you from people. And I think this is really profound because hearing is, it's so relationship driven. It's how we connect, it's how we share how we're feeling. And so some of these things that we're talking about, the impact on cognition, some of it's because you start getting disconnected from people. You start maybe even feeling suspicious. Are they talking about me? Are they leaving me out on purpose? Maybe I don't want to go to that event. I'm not going to have a good time. I'm not going to feel included. So then you start getting into social isolation and loneliness, which we know impacts longevity and health. So it's not one thing, right? It's all these little things adding up.
Well, you know what? We just went right to the meat of the discussion.
Oh,
And I really didn't get to have more of a conversation with you about what brought you into caring about this. Like we talked about, your mom did this, but plenty of people's parents do things that does not result in them making those same choices. My dad's an accountant, and accounting was the one class I got a C in college, and that was basic accounting. So we did not have the same path, right? So,
yeah.
what in your journey led you to follow in your mom's footsteps? And is that something you always wanted to do, or was that something that surprised you later?
It surprised me.
Okay.
I took a different path. I actually studied food science in college. I studied
Did
winemaking,
you
which was,
winemaking?
it was cool. Yeah. Yeah. I got to study abroad in Italy. I studied viticulture and enology, which is, grape growing and winemaking. It's really nice, like cocktail party conversation that I can talk, brag about that, right? But that's like a past life. Now I buy the same $15 bottle of wine we're all buying at the grocery store. But I think what I found in that was I was so fascinated by chemistry, by
Mm,
science. I probably should have gone in the biology direction. I just didn't realize that this is what I was going to do. I really took my own
sure.
path. But a couple years out of school, I'm in the profession. And as fun as it is, you might not be surprised to know it's not that professional.
No. What,
Yeah,
working with the people who drink wine all day?
yeah,
No.
exactly.
Surprising, isn't it?
Getting to 22, 23, 24, I was realizing it was lots of nights and weekends, and there was an
Mm,
expectation that everybody had a glass in their hand. There was a moment where I realized this was not going to be a career that was going to have longevity for me.
yeah.
And so I really had a total spin out where I did not know what I wanted to do. I know, but that happens to a lot of us in our 20s or beyond. But
Sure.
my husband is the one who said, you know what your mom does is so interesting and it's helping people and you're looking for something. Maybe you should go shadow her.
Well, he was right, I guess.
He was so right. I went and shadowed her and it was like an immediate click. Anybody who's in healthcare, most people have this feeling where you get to help somebody and you feel like you got more from the experience than they even got from you. And it's so gratifying. And it was like, oh my God, this isn't a job. This is a mission. So that's how it started.
It's so true. And well, and let me ask you this too, because I don't know much about. Now, are you an audiologist specifically?
I'm actually not.
Okay,
Not.
what are you called again?
I am a little known specialty. I'm called a hearing instrument specialist.
Okay.
And it's interesting. It's a technical apprenticeship.
Hmm.
So I did a year and a half apprenticeship under a sponsor, took all my state licensing exams. It's kind of like, how does someone go into finance and become a financial advisor or become a real estate agent? They have to study and they have to pass exams and keep up their licensure. But I employ several audiologists in my clinic. So we have different specialties within the clinic to be able to help everybody.
Okay, so what's the difference though between you and an audiologist?
There are some big ones. So an audiologist has a doctorate. So they go all the way.
But it's not enough to make them the boss of you, is it? Because
Well,
you own the practice.
you know, it goes both ways. It goes both ways, right? There are plenty of clinics where the audiologist owns it.
Oh yeah.
But both my parents owned their own businesses, and
Mhm.
it just clicked for me recently. My grandparents did too. I hadn't really thought about that, but
Wow, you're a very entrepreneurial family.
I was raised with that mindset of creating and um, employing, but feeling like I don't know if this term is nice, like a servant leader, where you're employing people, you're creating a job for them,
Mhm.
and in effect serving them too.
Yeah. And
But
how to do that effectively. So you had some good role models because a lot of
yeah,
people want to have their own business and quote unquote be their own boss, but then being somebody else's boss and having that responsibility for their livelihood too is another responsibility that doesn't always come to the forefront of your mind. But you grew up with that.
yeah, hugely. You could work nights and weekends for someone else, or you can work nights and weekends and beyond for yourself. And I think you're right. There's a lot of people who think the entrepreneurial path is gonna, it does give you a lot of freedom. I mean, am very thankful that I'm on this journey, but you'll work harder for yourself and have to be a better boss to yourself, to give yourself permission to take breaks and to set things down. And when you're a perfectionist, your standards are high, and so you can create your own worst job if you're not careful. But I've done this for 11 years, so I've had 3 or 4 burnouts during that time, if I'm being honest,
Yeah.
not because of the career, but because of ownership. I'm back in a place where I love it again. But
Well, and I wanted to ask you about that too, because you're like healthcare adjacent, I would say, I guess,
yeah,
because you're not in a hospital, for example, but you're definitely working in healthcare, helping people and preserving and getting their health better. But the burnout that you're talking about, with, I don't know, working too much, too hard all the time. Do you encounter like moral distress in your line of work? Because I really believe that is a big part of what drives burnout in other areas of healthcare, in the seeing and knowing the good that could be done for someone and not having the supplies or the resources to provide it to people. Is that something you encounter in the hearing world too?
wow, I've never heard that term, like moral distress.
See, if you were a nurse, you would have heard it, but
Yeah, you're right. I am adjacent. I'm not hearing those types of terms, but wow, that really puts
well, and
some words to it.
veterinarians have it too. I think a lot of it is like putting animals down or giving animals back to abusive owners and things like that, where they see a lot of suffering that they imagine they could do more for, but they can't, and
Yeah.
feeling that paralysis of like not being able to help as much as they wish they could.
Yes. I would say in 2 different ways I encounter it. One, we're going to get to your billion dollar question,
Sure, we'll get there.
but one of the problems in audiology is that insurance barely covers hearing aids, and
Yeah.
Medicare does not. Medicare
What?
excludes hearing aids. It's never
Um,
covered it, never has, no plan to do it.
but
So
Medicare is for old people, and old people need hearing aids.
that's what we're all saying. But,
We need to give hearing aids to the people who are choosing what goes in Medicare. Is that what you're saying?
I don't know where the funding comes from, what gets taken, what gets added. I just know that it blows my mind that
What in the
my
world?
patient population basically pays out of pocket for hearing aids that they need in order to
Yes.
be safe, in order to hear their doctor's instructions. Yeah, it's
Wow.
very disturbing. So that's number one. That's the first way. And then the second way is that, we have so many people who come to us late because of some of these hangups, maybe the stigma in their own mind, the cost. And hearing is one of those things you need to treat early or at least on time, because when you treat it late, those pathways have already started shutting down. And so I'm so disappointed and so disturbed that somebody comes in and I put hearing aids on them and I can help them to, a certain extent, but they're never going to get back what they've already lost. And so we're trying and trying appointments and follow-ups, and they're looking for like the next best thing and they can't find it. If they'd just gotten in sooner, we could have preserved a much better experience for life.
Wow. That is just so devastating. And I mean, I know like in stroke, it's really important to get in quickly because you can reverse those symptoms if you get in quickly a lot of the time. But would you say, like, is it hard to get in to see either an audiologist or a hearing aid specialist?
I think it depends on where you live. I'm sure that it's different in different areas of the country. I'm in Charlotte, North Carolina, and I would say no. I mean, I would think being able to get in within a few weeks in most areas would be very normal. It would
Right.
be maybe in more rural areas you could have months wait, but I don't think that's the problem. It's not the
Yeah.
wait.
Problem is the awareness and the costs, right?
Yeah, I think so.
Just checking because I mean, I don't know. Maybe
Yeah.
you have a year-long wait list too, and you're like,
Yeah.
more people should go into audiology. But since you gave your TEDx talk, what do you think about like how it has communicated? Obviously, it landed with me, but have you seen like that break through any in as far as raising awareness?
I do. And I am very humble. I'm humble enough to know it's not me. My talk is it's
It's a
gotten
little bit you.
it's gotten some views, but it hasn't had I know that there are so many advocates that are having an impact. So when I picked that topic at the beginning of last year, which would have been the beginning of 2025, I was seeing a post on CNN, a little something on LinkedIn, but I wasn't hearing patients just coming in talking about cognition being connected to hearing. And that's why I picked the topic. It was like, people
Hmm.
need to know, we
Yes.
got to get it out there. And there's been a wave of change. So I would
Good.
say by the end of 2025, not just because of me, but because other people must have picked up the baton, everyone is coming in the door saying that they have heard this somewhere. And it's a motivation for them because we want to keep our minds.
Yes, brain health is so hot right now. And I always would say I'm trying to make stroke sexy because 80% of strokes are preventable. And if you recognize it right away, you can treat it and hopefully reverse it. And then there's neuroplasticity with hope for recovery. So I'm all hyped about that. But you know what just beat everybody to it is this brain health and memory protection craze. And the thing is, the same things that you do to protect your memory and your brain are cardiovascular protective and protect you from heart attacks and stroke, and they protect you from cancer. It's all the same stuff.
It
So,
is.
whatever works, that's great.
Yeah. And to that point, I don't know if you know this, but obviously we've got little blood vessels
Mhm.
feeding our ear, our organs. And people don't realize that their cardiovascular health, when you're
Yeah.
taking good care of that, you're actually protecting your hearing because it's very common. People with cardiovascular issues, diabetics, are going to have a much higher incidence of hearing loss as they age. All it's head to toe. If we take better care of our bodies, we're going to have less of these side effects.
That is just, it's awesome though, isn't it? It's
Mhm.
hopeful. At least we know what works and we can just share it a lot. And I guess people will get the message. I know you definitely influenced me because, like, you had your TEDx talk and I saw that from Instagram to YouTube. And I ended up interviewing an audiologist about it on the in the stroke specific context, and which is where we talked about the way it can play into that rehabilitation success. And so, yeah, definitely, it takes a village, and we all have to do our part. So I'm glad you're doing that. And I guess I'll take us to our $1 billion question now. So, Madison, if you were given a grant for $1 billion to meet a need you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
Oh gosh, number one, I already alluded to it. There's no funding for hearing aids.
I
Insurance
didn't
doesn't,
realize that.
10% of my patient base has some coverage for hearing aids. That means that
Where's
90%
that coming from? Like private insurance?
from private insurance before Medicare. So there might be people who are 40, 50, 60, and they have some portion of coverage because they're on a really good plan,
Gotcha.
right? So,
Hmm.
how do you make it sustainable? Somebody a lot smarter than me would know how to fund this, but there's a need for hearing help, not just in the US, not just here, but globally. In other less developed countries, hearing loss is even more prevalent, and it's not caught in children, and it completely changes the course of their life. So I would
Mm.
love to see funding with $1 billion. We could do so much around the world to help people hear and have lives that contribute and are beautiful.
Wow. That I love that big picture. We've got to help the older people who don't have the coverage for the hearing aids and the younger kids to get screened. So, as you said, it affects the whole trajectory of their life. So, that's awesome. Let's do it. I think we can do it. And this is how we do it is putting the word out. So, that's awesome. And then if people want to reach out to you to either have you come speak or just connect with you, is LinkedIn the best place to do it? Or would you prefer Instagram where I found you?
Yeah, Instagram is at Madison Listens. You can also go to madisonlevine.com. And I love getting to speak in communities. I would love to get more allied health professionals thinking about hearing, because really patients need that comprehensive look. And we all have the opportunity to refer to each other in order to help patients get what they need.
So true. I love it. I love being surrounded by like plethora of experts. So it's like there's somebody for that and somebody for that. So I love teaming up with you like that. And I'll also put a link to your TEDx talk, the YouTube video in the show notes. So if any of you want to go and listen to that or watch it, it's amazing. You totally should. This girl's an artist. Like just go watch it for real and give it a like and help her stats with that because this is a very important message that really affects so many people. And if you've enjoyed this episode of the Nurse Rosa's Insights podcast, please like and subscribe wherever you are listening or if you're watching on YouTube. And feel free to leave me a comment. Let me know what you think. And I will see you in the next episode.